who from last year, April, with the economic crisis onset, came together. So we are activists, lawyers, researchers, old and young, who started seeing the impacts in our own work of the economic crisis and came together to understand what was happening and also to articulate what was happening, because we didn't see that narrative out there. A lot of the work that we were then talking about amongst ourselves, trying to understand what the conditions were and what the situation was in the country, was about social protection issues from the very beginning. So I'm just going to move into the first slide. We've sort of put out a few statements in relation to this work, and I think the last few months of this year, beginning of this year onwards, we've actually taken on some research where we spoke to people who are on social benefit schemes and are using that information now to shed light on what social protection has meant to Sri Lankans, right? So we've just taken apart what the system is currently, and I put it up in this slide. So we see social protection as a broader umbrella framework which has different types of protections. So there are citizenship-based protections. We see free health, free education, which Sri Lanka had from a long time back, nutrition for all pregnant mothers, lactating mothers, malnourished children under the age of 5, the Triposha, Poshanamalla schemes, all part of the universal social protection programs that Sri Lanka has. This has really had an impact on life of citizens in Sri Lanka, as you can see by the sort of development indicators, that Sri Lanka has actually really high indicators and has had that for some time, because this has been a long-standing universal social protection for citizens. Our finding is that over the decades that it has eroded because there has not been enough investment in these more universal based schemes. There have also been poverty targeted schemes like Samurdhi, livelihood assistance, microfinance facilities. These are all programs that are then run by the government targeting low income families. There are life cycle risk based schemes. So there is a disability allowance, there is an elders allowance, there is an allowance for patients with kidney disease from low income families that is currently provided. And then social protection also means employment based social protection, which is provision of for those employed in the public sector in the form of pensions and provident funds, and formal private sector again, EPF, ETF as we know it. There are also laws that say, and that's where I come in, right? The legal frameworks that intersect compensation for workman injuries, maternity benefits, and several other laws that also ensure that workers are protected. So it's a very, so you have to look at the social protection scheme not only as sometimes we reduce it to Samurdhi, the cash transfer scheme, but it has all of these aspects. So cash in kind, the free health, free education, and what it has meant for Sri Lanka. So in that context, we also saw that Sri Lanka is one of the countries that spends the least on social protection, right? Particularly if we looked at what countries spent on during COVID in the region, Sri Lanka spent the lowest on social protections in response to the pandemic. We have a mere 0.6% of the GDP on social assistance programs. That top chart, which has been taken from the UNICEF study on social protections, you'll see the 1.97, which is the large blue part of that pie chart, is what is for social insurance, which is the pensions as well as the pensions benefit given to military widows. And the IMF has told us that they expect this mere 0.6% of GDP, which Sri Lanka currently spends, to be what Sri Lanka will also spend this year on social protections. So the fact that we are in an economic crisis, people experienced the economic crisis last year, has not meant that there has been this response that has met what the people are experiencing. We know from studies with the World Bank that Samurdhi does not reach 40% of the poor as the system was experienced before all of this crisis, right? So it was not working even then to reach vulnerable groups. So the second chart there shows what the state expenditure has been towards social protections. The line in red shows you the Samurdhi progression. So it's fairly been the same. So it's about 1.7, 1.9 million beneficiaries under the Samurdhi scheme. Whereas you see the pension scheme go up, and the study says that this is because military widows have increased the social spending, or the public spending on those pensions have increased. So I think it's really important, and while we were doing this, it was really important for us to understand what Sri Lanka was doing before these crises hit. And we are talking about both the COVID, the pandemic, as well as the economic crisis. So as those shocks were experienced, 1.9% of the Sri Lankan population, people in Sri Lanka, were food insecure even at that time, right? So this is 2019. 9.2% households were on Samurdhi, which is about 1.7 million families whose households earn less than 6,000 rupees. We know also that there are particularly vulnerable areas. So the estate areas, for example, 1 in every 2 persons live in poverty, 51.3%. So we know that there are areas that are particularly vulnerable to shocks. So in both the pandemic as well as the economic crisis, there ought to have been a more concentrated effort in those areas, which we will later see didn't happen. We know that when you look at where people living in poverty are, 8 out of 10 people living in poverty are in the rural areas. We also know that there are other vulnerable communities, for example, conflict affected, urban poor, that is coming up on our radar as well. Sri Lankans who are discriminated against for reasons of either sexual orientation, nature of the work they do, like sex workers, they don't even get onto these social benefit schemes because of the discrimination. So then they are excluded. So these are things that are on our radar as saying, if you have social protection programs, how do you address these exclusions as well? Next one. We also know that by simply talking to people, average wage of a free trade zone worker was about 26,000 last year. 15,000 for a domestic worker per month. 15,000 a month for a plantation worker. And we also knew that they were experiencing hardships based on the fact that there was a fight for a 1,000 rupee wage. When the 1,000 rupees was ordered by the wages board that it should be paid for every worker, companies started engaging in other tactics, such as increasing the norm, which meant that the worker couldn't collect that much per day and could not then get the 1,000 rupees that was said to be paid to them. So there are various practices both towards trade unions and workers to undermine even that mere 1,000 rupees a day wage that had been hard fought and won. We know that the cost of basic living increased to something like almost 100,000 rupees per month to get basic necessities. But we also knew that only 2.6% of the workforce was said to earn 100,000 rupees per month. So that left everyone else out there vulnerable in various ways to various degrees. And what we saw as a response during the economic crisis was lump sum 5,000 rupee payments. Maybe some people got it twice. So the disparity of the 26,000 rupees a month or 15,000 rupees a month wage versus cost of living being something between 70 to 100,000 rupees a month, the social protection response there wasn't anything that was adequate. 5,000 rupees a month is not going to cover those expenses. So we were really asking the question whether Sri Lanka was serious about addressing vulnerability. And it is because of those questions that we decided to talk to people about this, and I'm going to hand over to my colleague Madhulika to take us through some of those findings.
Yeah, thanks, Ermiza. So, like Ermiza said, the main objective of our research was to sort of document the experience of this crisis, especially of households during this current economic crisis. But when we did these interviews, this research, the things that came out was that it wasn't just one crisis. This crisis didn't exist in a vacuum, and it was multiple crises and the impacts accumulating. So, for example, people who were affected by the war or natural disasters, you saw that they lost their assets and ways of earning their income and their livelihoods. On the other side, in 21, we saw the fertilizer crisis, so we saw the agricultural shrink, and that was actually when the food insecurity and the food crisis started. So our study was a qualitative study, and we documented very thick descriptions through detailed interviews. We did 15 interviews for 15 people from Kilinochchi, Jaffna, Batticaloa and Colombo, and this was done during January. And those who were interviewed were either receiving or on the waiting list for Samurdhi, PMA, that is Pinpadi, Elders Allowance and the Disability Allowance. So at the time that we were doing our interviews was when the government was rolling out its enumeration process for the Asvasuma welfare benefits payment scheme, the new scheme that will start in July. So we asked a bunch of very broad based questions, age, what kind of work they do, and then we wanted to identify the impact of the crisis in terms of expenses, in terms of livelihoods and incomes. And one thing we already found, it was very apparent, is that incomes were incredibly insecure. People were not only lost their purchasing capacity due to the cost of living, but because either incomes and wages remained stagnant or it declined. And the majority in our cases, we found 7 people lost jobs and work during the last year because of the crisis, and the majority couldn't work because they were unable to work due to a disability or due to their age, or they couldn't find work. And most who did work and did earn income were daily wage workers. So whatever they earned on a daily basis was for daily consumption, and that was mainly for food. So cash for emergency was actually strapped. So they would either forego meals on a daily basis to pay off emergency cash, like cash needs like utilities, or they would go towards microfinance loans, and that would again create this cycle of debt. So debt for utilities was something that was recurrent throughout all the interviews that we found. At least 25,000 a month of debt was accumulated in every household, at least, or they borrowed 3,000 rupees a week in terms of personal microfinance, sort of loan shark kind of loan agreements. So I put up 2 case studies here to show that income is one side, but there was a collapse of livelihoods also. So one case here we were given with debt. There were 2 women that we interviewed in Colombo. They own a retail shop and they run it in their own living room. But the thing was that during the pandemic, while they had stocks and they were able to restock once lockdowns were when it was lifted, during the crisis they didn't have stocks at all, especially the stocks that they can sell, the high sales stocks like milk or eggs. So that means they couldn't earn any income from their own business. So what they resorted to was getting stocks on from their wholesaler on credit. So this household, I mean these two women, they got for like 20,000 rupees a month, and every month what they earn, they use it to pay off last month's debt. And this is just their business debt, right? That doesn't include their daily expenses, utilities, or food expenses. So about 3 months worth of bills for electricity were piled up in these households. And on the other side, we have a case of a fisherman from Batticaloa. He was a fisherman until last year because of the whole kerosene crisis and the fuel crisis. So there, what we saw was, it wasn't just one crisis again. His fishing capability was actually restricted by the Indian trawlers that fish, and that reduced the amount of yield in the fishing area. Sorry, this is in Jaffna. So it was Indian trawlers, reducing the yield that they could get from each day, and the kerosene crisis on top of it meant that they were incapacitated in their livelihoods, in their capability of getting more money for that day. So what he resorted to was shifting. He gave up his fishing, to start a fishing shop, because then they figured that that's less volatile than actually going out and fishing due to the cost. So a lot of these cases, what we found was that not only is it just one crisis, but people have been resorting to very creative solutions, and still those solutions weren't enough because they were still exposed to more vulnerabilities, or exposing themselves more to more risks. And this case is one woman who applied for the disability allowance. She was in the LTTE, and she was forcibly recruited when she was 14, and then once the war ended, she was deaf in 1 ear and blind in one eye, and she was married off right after the war and faced severe domestic violence. But because of the violence, to escape it, her and her son left the marriage. She left the marriage and she settled in a different village, and there again, because she was a single woman raising a child, she faced a lot of ostracizing in her own community. And the reason why she couldn't get her disability allowance was because the government officials said that because she was only deaf in 1 ear and only blind in one eye, she wasn't eligible. So now she works as a domestic worker. So it goes on to show that a lot of these benefits are denied based on just absurd requirements and requirements. And then we come to one of the biggest part of our interviews, because we put a lot of thought into getting more information on food intake, food insecurity,